Hello, I'm Dr. John Sweetenham, the Associate Director for Clinical Affairs at UT Southwestern's Harold C. Simmons Comprehensive Cancer Center and host of the ASCO Daily News podcast. Hurricane Ian, a large and destructive Category 4 hurricane, has caused fatalities and widespread damage in Florida after causing huge destruction in Cuba. Communities in the hardest hit areas have been destroyed, and hospitals across the state have been forced to evacuate patients. Today, I will be speaking with Dr. Eduardo Sotomayor, the director of the Cancer Institute at Tampa General Hospital, about the impact of the hurricane on cancer care. Our full disclosures are available on the transcript of this episode, and disclosures relating to all episodes of the ASCO Daily News podcast are available on our transcripts at asco.org/podcasts. Dr. Sotomayor, thanks for being on the podcast today.
Oh, thank you for having me, John, at the ASCO Daily News podcast.
To begin with, Dr. Sotomayor, could you tell us a little about how Hurricane Ian impacted cancer care at your institution? And how soon do you think you will have all of your cancer services restored?
So thank you for the opportunity to talk to you about the effects of Hurricane Ian's on the state of Florida. But before we start, I was to say that our thoughts and our prayers are for those Floridian citizens that were severely affected by this hurricane. In particular, our cancer patients and their caregivers. So Tampa General Hospital is located in Davis Islands. So we were at high risk for having inundation, for having major destruction and disruption of cancer care if the hurricane will hit us directly. So we were blessed that at the last minute, the hurricane changed path. But it is important to emphasize all the preparation that took place starting 7 days before the potential landfall of a hurricane in the state of Florida. So this started at the highest level of the hospital with the senior leaders getting together as well as the leaders of the Cancer Institute. We have different scenarios that we call scenario A, B, and C. So the scenario A was the worst case scenario that if we would have a direct hit, then 1 or 2 floors of the Cancer Institute and the hospital will be underwater. So for that scenario, so we knew that we need to be ready to move cancer care to other facilities that Tampa General has inland in areas called Riverview and Brandon. So a scenario C is the scenario that, fortunately for us, a scenario that we deal with during a storm. So we didn't have a direct hit, we have only minimal damage, and we were able to reopen our doors 48 hours after the storm hit the state of Florida. Important to mention also that during those 48 hours, there was significant disruption in cancer care. In the inpatient service, we have to decrease the number of inpatients to keep those patients that really need to be in the hospital. We close all our outpatient facilities, and therefore we need to call every patient to let them know about cancellation of appointments, but also rescheduling those appointments for the days after the storm has passed. So as I said, again, we were among those lucky Cancer Institute cancer centers in the state of Florida, but south of us, there were hospital, community oncology practice that were severely affected by Hurricane Ian.
So it sounds to some extent, Dr. Sotomayor, as if your institution kind of dodged a bullet, although clearly people south of you were very badly affected. But I'm assuming that there have been some disruptions to care for your patients. Can you comment a little on that and what you're doing to address the disruptions to care, assuming that you experienced even though you didn't take a direct hit?
What we have learned from this experience is that preparation is extremely important. I would say 24 hours, we created a command center, the operations team, our logistic team, safety team, and we start canceling those appointments that were not critical. When we knew that the hurricane was coming in our direction, then we have to cancel all our operations. But then we had meetings twice a day with different members of our team to start making phone calls also regarding cancellation of appointments. And then as the days go, so we start to adapt our plans and we start to call back patients. What is important, I think, a silver lining of the COVID pandemic has been now the availability of telehealth, of easy communication with patients. I think the patients are now more savvy with managing telehealth. So the days after the hurricane hit us, we have some patients that have to come back to receive chemotherapy infusion or radiation, but the large majority of patients we were able to manage via telehealth.
Yes, thank you. I know one of the questions that I was going to ask you a little later on was whether the telehealth infrastructure that was developed during the COVID-19 pandemic was helpful in response to the hurricane. And clearly from your comments, it has made it easier in terms of patients' familiarity with the platform and so on. So that's good to know.
Right. And also, just to add to that is that technology before the COVID pandemic, so we will be facing a similar situation. Basically, all our call centers will be closed. So these days we have technology in which employees or members of our team that were receiving or making phone calls, now they can do it through special apps in case the internet goes down or electricity goes down. Still now there are systems that can allow temporary communication with patients in a more timely way.
Yeah, that's very reassuring. The Florida Hospital Association has said that many hospitals are feeling capacity pressure. Can you comment on whether the Tampa General Hospital is able to help by perhaps offloading other institutions that were badly damaged in the storm, particularly those in the southwest of Florida?
One of the things that I have learned is significant percent of cancer care is performed in the community. Communities that were affected by this hurricane, and therefore, I think it is important to keep that open communication between academic centers and oncology practice in the community. With reference to your question, Tampa General has 6 helicopters. It has a command center, and as soon as it was safe for our helicopters to travel, they went to these affected areas. There were hospitals in a nearby our region that didn't have electricity, they didn't have water. I am proud of the service provided by Tampa General Hospital to other hospitals and cancer care communities that were severely affected by the hurricane. I think so far we were able to transfer between 50 to 70 patients that were in critical condition and needed to be removed from those areas that were significantly affected by the hurricane. And I have to say, Tampa General Hospital is just one of the hospitals, but all the hospitals in the state of Florida join efforts to help our patients in general during these difficult times.
Yeah, it's certainly great to hear of the oncology community and healthcare community in general coming together to overcome the challenges for so many of these patients. One of the challenges that occurs to me, which might be an issue for you because of your increased patient volumes, as well as for those centers who've been more directly affected by the hurricane. And that's the issue of supply chain and availability of medicines, and particularly chemotherapy and other antineoplastic drugs. Can you comment on whether you're experiencing any supply chain issues with medicines, or whether you're aware of other organizations in the southern part of Florida who are having those challenges at the moment?
So there are 2 answers to your question. So if we are lucky to be in an urban communities, I think that supply chain was not significantly affected, but the problem has been in the rural communities in Florida. And unfortunately, in addition to the areas nearby the ocean, Fort Myers, Naples, Port Charlotte, the track of the hurricane through Florida affected the rural communities. And in those rural communities, the problem was flooding. Several trees went down. Access. In those areas, they are still dealing with significant problems in the chain supply. What we are doing, again, all the other, the big centers are trying to do their best to either provide those supplies to these areas that have been affected or transfer some of the patients from those areas to, I would say, urban hospitals that have more capabilities.
So this raises, I think, a really important issue. We know that very typically underserved communities are disproportionately impacted when there are natural disasters. And to your point, it's clear that you've seen the potential for significant disruption to rural versus urban communities as a result of the hurricane. Do you have any other thoughts or maybe any other examples of how disproportionate care may have arisen because of the effects on underserved communities?
Even before any natural disasters, rural communities, and I want to focus on rural communities in the state of Florida because there is a significant number of Floridians that lives in rural communities. And if you look at the incidence of cancer and mortality associated with cancer in those rural communities, is far superior than that mortality that occurs in urban or in big cities. So number one. And there are several issues. There is transportations, access to care, very few providers, oncology providers in those areas. So even before that natural disaster that just happened, so those communities were in significant disadvantage. And unfortunately, not only the hurricane affect those rural areas, but now I would say the organizational capabilities, the few organizational capabilities that they have been even more affected. So therefore, when we thought about the impact of the hurricane in the state of Florida, we should also be thinking about our rural communities. They are the ones that are going to take the longer, perhaps months or even a year, to recover from the significant damage that Hurricane Ian has imposed upon those communities.
Switching gears a little, are you concerned about the disruption of research and clinical trials in parts of Florida in the months ahead? I'm just thinking with issues such as maybe, initially it will be scheduling of treatments, perhaps, but transportation disruption and so on. Do you see these as being potential threats to clinical trial activity in the state for the coming months and possibly years?
So again, I think the clinical trials in big centers in urban areas are going to be able to recover relatively quickly. I mean, for instance, our clinical trials operation is back to normal, was not affected. So there is a big community oncology practice in the state of Florida, Florida Cancer Specialists. They have an active clinical trials, but they have locations in several of the areas that were significantly affected by the hurricane. So I think in those areas, it is going to take time to recover. But in my early conversations with our colleagues at Florida Cancer Specialists, they are going to be moving some clinical trials operation from those affected areas to areas that are fully functional. But definitely, there is going to be a disruption. And unfortunately, that disruption is going to affect to those patients enrolled in clinical trials that live in underserved areas, and in particular, those that live in rural areas, because access transportation is going to be a significant problem for them.
Yeah, absolutely. The hurricane, I think, is, one of the consequences of what the emerging climate changes that we've been seeing over many years now. And certainly there has been a significant interest in the literature and indeed on previous ASCO Daily News podcasts regarding the impact of climate change on cancer care. And perhaps the most immediate example of that is in terms of disaster preparedness of cancer centers. So, and certainly that has been tested for you and for other centers in Florida in the last couple of weeks. How would you assess the readiness of your cancer centers to respond to disasters of this scale? Do you think there are areas of care that you've now learned need more attention just as a direct consequence of this most recent hurricane?
So I think it's going to be location dependent. Florida is a big state. For us and other centers that are in an islands, the surge was probably the major threat for us. I mean, there is a technology now of called aqua fence. So basically, there are panels that will help you to be able to give you time to evacuate or to protect the lower floors of the cancer center of the TJ hospital as a whole. It's called aqua fence. So we installed those panels around the whole hospital. And I think that's one of the technologies. And we are going to see more and more of those technologies to try to protect or minimize the potential damage that a hurricane can cause. I mean, my prediction probably is going to be able to support a hurricane category 2, 3, or even 4, but 5. So time will tell. So we need to start thinking more about technology. So that's in our case. So there are other cancer centers that are inland in which the problem for them is going to be flooding. So one lesson that we have learned is there has been a constant communication between all the cancer centers in this region. In the academics, to University of Miami, Florida, us, Moffitt Cancer Center, but also in the community, Florida Cancer, especially community oncology practice. And I think that if you ask me, so what will be the next step? It will be to foster a stronger communication, a stronger collaboration that involves also our community oncology practice. Because as you know, John, most of the cancer care now is happening close to home.
Well, thanks for that. I think that's such an important message. And I should add for our listeners that you can find information about disaster resources for care providers and patients on the ASCO website at asco.org. Dr. Sotomayor, I just want to thank you again for giving us your time today at what must be a really busy time for you all, and would like to wish you and our many colleagues in the region, especially those in the hardest hit areas of Southwest Florida, all the best during difficult and uncertain times as they try to recover from the hurricane.
There are too many heroes here talking about cancer care, oncologists, nurses, APPs, MAs, that they left their families at home and they went and stayed with patients. So I am proud to say that most of them, they offered to go there. We didn't need to say you and you and you. It's just, and I want to thank all of those, our colleagues, providers, all the team members in all the hospitals, a big, medium size of small in the state of Florida, that they left their loved ones to be supporting and taking care of our patients.
Certainly heartwarming to hear about that kind of response. And thanks again to you, Dr. Sotomayor. And thank you to our listeners for your time today. If you value the insights that you hear on ASCO Daily News Podcast, please take a moment to rate, review, and subscribe wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.